Hello, this is Junkai, the Business Development Manager for Telehealth Business from Advantech headquarters. Today, I would like to introduce you our telehealth solution. And basically, our telehealth solution is providing a telehealth card to the medical professionals, which is AMiS-72 telehealth card besides me. And it also can be seen as a mobile workstation that is equipped with a video conferencing system, a medical computer, and a battery system. So for the video conferencing system, it features a high quality PTZ camera that supports a full HD resolution and 18 times optical zoom. And it also features a high quality speakerphone that supports a digital signal processing technology and echo cancellation. So this video conferencing system allows the doctors and the patients can see and hear each other very clearly, even they are not at the same place. And this telehealth card also has a clinical grade panel computer with a wide touch screen. And this is specifically designed for medical environment and supports fast data transmission and fast data computing. And the work surface of this telehealth card is waterproof and dustproof. So it is very easy for daily decontamination. And it also has a drawer to store some documents or medical devices. And this card also features an electronic height adjustment. So it can be used in a very ergonomic way. And then as a mobile workstation, this telehealth card has a battery power system with 8 to 10 hours battery life. So, which means medical professionals can use this telehealth card without charging during a whole shift in hospital. And then the battery power can be remotely monitored by an intelligent power management software. So with this telehealth card, the medical professionals and the patients can connect with each other to provide healthcare services anywhere and anytime. No matter it is for inpatient care like emergency department, ICU, isolation room for COVID-19, or even for routine ward rounds in hospital, or for outpatient care like in rural areas or the community clinics or health centers, or even for long-term care. Our telehealth solution can be well applied into these scenarios. So why healthcare providers need our telehealth solution? For example, medical professionals can use this telehealth card to do virtual ward rounds, which can save more time and expand the doctor's capacity to care patients. And the virtual ward rounds is more and more popular around the world. And this telehealth solution can also help build a virtual clinic in rural areas to increase their accessibilities to more medical resources. For ER and ICU, the telehealth solution can also fill the staffing gap and reduce the patient's waiting time by enabling the virtual cooperation between bedside staff and the remote care teams. And our telehealth solution can also protect medical professionals from infection by reducing the frequency of entering the isolation room, but still can give treatment to the isolated patients. Last but not least, medical education like surgery demonstration and medical conferences can also be assisted by the telehealth solution to maximize the effectiveness. Besides telehealth card, our solution also includes a video conferencing software which is HIPAA compliant. And it can secure patients' data and patients' privacy. And it also supports remote camera control and remote annotation. And most importantly, it can support video streaming from third parties' medical devices like digital exam scope, EKG, and ultrasound. So our solution also includes a digital exam scope, which is comprised of one control unit and 3 exchangeable lens, which are, this is the control unit, and the 3 exchangeable lenses, which is our dermatoscope for skin examination, and otoscope for ear examination, and the general scope for the throat examination. So the images of this digital exam scope can be transmitted in real time, which gives the doctors at the remote site more evidence to do more precise diagnosis. Here I prepared 4 use cases for you to have a deeper understanding of how telehealth solution works in the real world. The first case is in Taiwan, and it's a teleconsultation in rural area. In rural area, most diabetic patients are elder people, and they have to travel a long distance to have regular eye examination at the medical centers in urban area, which is very time-consuming and exhausting. So with our solution deployed in the rural areas health centers, the patients can easily access the specialist to do eye examination and get treatment recommendation by just visiting nearby health centers. And the second case is also in Taiwan, but it's a dermatology teleconsultation in mountain area. But the concept is quite similar to the first case, which our solution is deployed in a community clinic, which allows the residents in the mountain area can easily access the dermatologist directly. And the third case is in the Middle East, in Qatar, and there is a large medical corporation called HMC, which operates 9 hospitals in Qatar. And according to a report, HMC received around 1,600 stroke patients every year. But unfortunately, the number of the doctors is insufficient for each hospital to do immediate assessment for the stroke patient because there are too many patients waiting in the emergency room. So HMC placed our telehealth card into the ER of each hospital and then used the telehealth card to connect a centralized remote stroke team to do patient assessment and give treatment advices immediately. So in this way, HMC can increase the efficiency for handling stroke patients without hiring more medical professionals. And the last case is in the US, and there is a large health system called Banner Health, which runs about 28 hospitals across 6 states. And even a large health system like Banner Health is still facing the physician shortage, especially in the ICU. So Banner Health put our telehealth card on the bedside in the ICU, and which allows the bedside nurse can cooperate with the remote physician team through our telehealth card to give a joint treatment for the patient. So the benefit of telehealth solution is very obvious here, which increase the efficiency but reduce the cost. Okay, so here I want to do a simple demo of our telehealth solution for you to have more understanding of how it works in the real world. For example, the video conferencing software and the horoscope. And here I would like to introduce you our marketer, Allison.
Hi everyone.
Yeah, she will be our remote doctors at this demo. So imagine that you do a virtual visiting to doctors through our telehealth solution. So usually a teleconsultation just simple talking between patients and the doctors. But here I want to share some features of this video conference software. The first one is the remote PTZ camera controlling by the remote doctor. So as you can see, the PTZ camera is controlled by Allison. So she can use the control panel to control the pan and tilt angles and the zoom in, zoom out to adjust the PTZ camera to the best angle and adjust the best way to see the patients. And then besides the just simple talking, as I mentioned before, a telehealth solution needs more evidence like image examination. So here I would like to introduce you the horoscope, the digital exam scope, and which is a control unit with 3 exchangeable lenses, which is general scope, and the otoscope for ear examination, and the dermatoscope for skin examination. So, I want to show you the otoscope for ear examination. So, simply plug the lens onto the control unit, and then make sure you turn on the device, and then connect to our telehealth card. And then in the video conference software, just simply press the add another camera, and then you can see a third screen on the window, which is the real-time images from the horoscope. So here I would like to do a ear canal examination, and then you can see the real-time this way. So you can see this is the real-time images of my right ear canal, and then by just simply press the OK button, you can capture the images. And these images can be transmitted in real time to the remote doctor, so Allison can see the same images in the meanwhile. And then I want to share these images to allow Allison to do some control, which is, I mentioned before, this video conference software supports a remote annotation, which shows here. So Allison used the pen tool to do some color here to specify where is normal and where is abnormal. And besides pen tools, you can also add text, like she adds the abnormal to specify this area, maybe some lesion or abnormal areas. So this is the video conferencing software features about how we can do more interaction through these tools. So after the otoscope for ear examination, so now I can try to change the lens to the dermatoscope for skin examination. So you can see the images here, then yes. So here you can see this is my skin, so you can see some hair here, and also press the OK to capture these images, and Allison can do some drawing and add some text here. Yeah. So this is how we share the exam images to the remote doctors. And if you have a 4th or the 5th medical devices that supports the UVC format, you can also connect to our telehealth card, and then it can be simply add another camera in this video conferencing software, so you can have a fourth, a fifth window for another medical devices images. Then, okay, we should say goodbye to Allison. So bye bye.
Bye.
So after you leave the video chat, you can go back to the video conference software, which also supports a simple text messages. So you can use these kind of text messages to do a simple communication before the video chat. So this is the demonstration of our telehealth solution, the AMiS-72 telehealth solution. So if you have any questions, please feel free to contact me for more information or more details. Bye bye.